Good afternoon, and thank you so much for joining us today. This is Becky D., your host for the Wellness Connections monthly webinar. I'm here with producer Ben G., who's making sure all the technology does all the things that it's made to do. And I also have a very special guest I'm about to introduce to you in just a minute. Again, thank you for taking an hour out of your day to spend with us talking about medical cannabis and inflammatory bowel disease. Just some housekeeping. Your microphone is muted, but we do want to hear from you, and we hope that we can answer all of your questions. If you have a question or a comment, somewhere on your screen there should be a bar with a sort of a talk bubble icon. If you click on that, you can choose to type in a message that only we can see, producer Ben and I, or one that everybody in the audience can see. So that's the way to put your hand up and let us know that you've got something to say. I'm Becky D., and I am joined today by a really special expert guest. He's a WCM member and a patient who has grappled with IBD for a long time now. His name is David, and at his request, we're not going to share his last name. But David, welcome to the webinar. Thank you for being here.
Thank you, Becky. I'm pleased to be here and to share my ulcerative colitis story.
Awesome. Well, why don't we, before we dive into the science and everything, do you mind telling us a little bit about yourself? I understand that you're sensitive about revealing your full identity. Can we start there? Why is that?
Well, there seems to be in the world of work, political and organizational issues such that it can always run the risk of coming back at you with disclosure.
Right.
And it's just a societal issue that I think will go away.
I have to agree with you, and I think that by doing this sort of educational outreach, you're helping to end that stigma. But if you're listening in and you've been in that position, I think that makes sense. The choice to be a medical cannabis patient is one that's between you and your doctor and maybe your family, maybe some friends that you trust. David, can you tell us a little bit about your journey with UC and how did we end up here?
I was diagnosed with ulcerative colitis about 15 years ago with a moderate severe case, and was told that ulcerative colitis related to Crohn's but not as severe was chronic, that I would have it the rest of my life, and that it would come and go, sometimes unexpectedly and with and without medication. Which I found to be true. I have taken the corticosteroids and with obvious terrible side effects, but that did put the colitis in remission. And more recently, the mesalamine-based medications, which are extremely expensive, have certain side effects that may or may not be important to you. And most important, by their own claim, they may or may not work. And they may even cause a worsened condition of ulcerative colitis.
So I don't mean to interrupt, but just to clarify that, so some of the pharmaceutical prescription drugs can actually make the problem worse?
Correct.
And you don't know until you try it.
And you don't know even in the middle of it. I did find that my experience was that it did come and go, or would come for a couple of years and go away for 1 or 2 months. So it was mostly an on situation that was reasonably managed by the medications. And in more recent years has gotten, in my case, a little bit worse. Probably worth mentioning that the two primary symptoms for me were the pain and cramping that then is followed by an urgency such that you have so many minutes, and in my case, in a small town, I know where every bathroom is located and how many stalls are there. Yep. And the other problem with ulcerative colitis is the bleeding, which indicates an inflammatory process in the colon.
Right. And we'll get into detail. I don't have pictures, but we do have some cartoon images that will help folks sort of visualize what's happening in there. So 15 years ago you were diagnosed, and when did you begin, when did it dawn on you that you might want to try cannabis to calm your symptoms?
Well, in the last couple of years, as I said, it had gotten worse, and I've tried different medications and different diets. I tried the gluten-free and all the fancy, trying to do anything to calm my colon situation. And almost as I overheard a conversation where someone was talking about their Crohn's disease, and they were taking a injection called Humira, and it was quite expensive and wasn't working. And then they leaned into the person and said, "But I recently went on medical marijuana, and I'm down to one shot a month."
Wow.
And I started thinking, well, Crohn's is related to ulcerative colitis, and I'm driving home, and I get home and I go online, and I see that there is some anecdotal connection between colitis and cannabis use. Next step, I realized that my adult children had cannabis in my basement for when they come to visit, and off I went to the basement. And I know this was December 28th, 2014 was the day. I went down to the basement, rolled a joint, and just at that minute, I started to get the cramping, and I thought, uh-oh. Well, I fired up the joint, and within a minute, the cramping had absolutely ceased, stopped, and it never came back. That was an immediate, I didn't know for how long it was going to last at that point, but in fact, it never returned.
Wow.
And then I was still on a full regimen of the mesalamine-based medications, and over the next 6 weeks, starting at probably about the 2-week period, I noticed a diminished bleeding.
Wow.
And by the end of 6 weeks, the bleeding had stopped. I had stopped taking all the mesalamine medication, and here we are in 2016, August. It has not returned.
So a year and a half plus, you've had remission.
Full remission.
Full remission. We've been able to throw the pills out.
Gone.
And maintain. That's amazing. David, I appreciate you sharing that background, and I'm so glad again that you're with us today. I think your experience and what you have discovered through your journey are going to be very helpful to our listeners. So let's dive right on in. When we're talking about medical cannabis in Maine, of course, we do have a state-regulated program, and that includes a list of qualifying conditions. So if you have a gastrointestinal disorder, you might be wondering, is that on the list? Well, inflammatory bowel disease is a specifically called out listed condition, and that is an umbrella term, as we're going to learn more about, that covers ulcerative colitis like you have, David. It covers Crohn's and a few other types of inflammatory diseases. It doesn't cover inflammatory bowel syndrome, which, as we will see, is a sort of a less intense irritable bowel syndrome, which is a less intense form of this type of disorder. However, you see in Maine's medical cannabis law, any chronic or debilitating disease or medical condition that produces pain that has not responded to ordinary medical or surgical measures for more than 6 months. And David, in your case, 15 years almost. But those would qualify. So if you don't have the label yet that you have Crohn's or UC, there is still a path for you if you choose to experiment or to look into this for yourself. So let's look at the sort of the family of inflammatory bowel diseases. All of these on the sort of left-hand side of your screen are marked by inflammation and ulcers forming throughout, in some part of your gastrointestinal tract, and that can be from beginning to end, right? In UC, these ulcers, the name says what it is. You're getting open wounds or sores in the colon. It tends to have a continuous pattern, and as David has alluded to, you get pain, bleeding, changes in your bathroom habits and in the stool that you produce. Whereas with Crohn's, you may have spotting throughout the gastric. It's not just limited to the colon, and it may be in more than one spot, whereas UC tends to be, as it says, continuous. Some similar types of symptoms, Crohn's, you're more likely to see vomiting and significant weight loss. David, did you ever have that sort of reaction? Any weight loss or?
No.
No, okay. No, unfortunately. You definitely, I guess in my research, it seems that in the early stages, it can be difficult for physicians to pinpoint whether you've got UC or Crohn's. In your case, you didn't find, it was pretty obvious what was going on?
Yeah, it followed the outline here.
Gotcha.
Continuous,
Yep.
restricted to one area.
Gotcha. Gotcha. And then there are these other types of colitis, collagenous and lymphocytic. They're called microscopic colitis because it's technical, but basically the actual colon tissues themselves are experiencing change, and in one case, fatty buildup and some blockages. All of these under the IBD umbrella involve damage to the tissue itself. Right? There is an ulcer going on. There are sores, fistulas developing with Crohn's that can often happen, infections, things like that. With irritable bowel syndrome, you don't have that damage to the actual tissue. Again, it can be extremely painful. It can make socializing, problematic. It can make something as simple as sharing a meal with somebody complicated, but it does not involve damage to the bowel tissue. So. All right, I promised you cartoons, and cartoons you get. I will say that if you Google these, ulcerative colitis or Crohn's, and look at the image searches, you can actually, see some colonoscopy photos of what's happening here. But this is just to visualize what that prior slide said. On the left there, you see Crohn's disease with inflamed spots throughout the lower GI tract, whereas with the UC, it is just in the colon. And then on the right, we have some differentiating images that might help to understand. With Crohn's, there's fat that's wrapping around the colon from the outside. There's lack of muscle strength. There can be fissures or cracks in the colon, whereas with UC, within the mucosal coating inside the colon, there are these sores that form. So. And, you touched on some of these in sharing your story, David. These are the common medical treatments for both UC and Crohn's right now. Can you share with us a little bit of your experience? Have you been through all of these, the anti-inflammatories, the immune system things?
No, I've only used in the first category, the anti-inflammatories. I've had the mesalamine and the steroids. And the steroids with the obvious side effects, undesirable, although it did put the colitis into remission.
So, we're going to talk about side effects from cannabis in a moment, too. I didn't list them here, but having lived through them, can you talk to me a little bit about the side effects of these steroids? What did you experience?
Sleeplessness, increased appetite to the point of weight gain, and you get that typical, the face takes a new shape. I forget what it was called, but your face actually changes shape. Yeah, you can almost tell when someone is on this, but and then it goes away. So fortunately that all went away, but it was a terrible side effect.
Wow.
And mesalamines with no noticeable side effects, but limited for myself, limited birth. They didn't really stop the bleeding or the cramping, and perhaps made it worse. Not sure, undetermined. Then the biologics where Humira is categorized, never had any of those, nor the antibiotics.
Okay, gotcha. I was interested to learn, you mentioned your friend who was on Humira and actually got to use less and less of it. Stelara is another one that you'll see on the TV, they're advertising for it. Many of those drugs were originally for use with psoriasis, rheumatoid arthritis, and other other inflammatory issues. You, before we went on the air, David, shared with me an interesting, I don't know if it was related to your UC, but you said you had some skin condition. Can you tell us a little bit about that?
For years, I have had on my legs psoriasis, or old man skin, I think we call it, and always festering and terrible itching. And just as an aside, I was never able to get rid of it, went to the skin doctors, and just as an aside, it also went away along with the colitis. And for over a year, I've had no skin lesions.
So when you started with medical cannabis,
that's right.
Your colitis symptoms went away, and then this skin thing resolved?
It went away after years as well.
And you're not, are you using topicals on it, or is this?
No.
Interesting. Very interesting. So we're going to go into sort of the anti-inflammatory and immune system mechanisms that are happening here, but that is fascinating to know, especially when you told me that. I thought, well, he must be using topicals, but no. Interesting. Antibiotics, the science is saying not a whole lot of evidence that they are effective. Did you change your diet? You've tried the gluten-free?
Tried different diets, and they always said that, told me, the doctor said that colitis was not related to diet. And I think that is fine and true when colitis is in remission. It doesn't trigger colitis. But in fact, when the colitis is active, then a lot of foods make a difference.
And we'll talk about...
Stay away from peppers.
Stay away from peppers. Good advice. And we're going to talk about eating your cannabis medicine, too, and how that plays in just a bit. So, all right, so these are the common pharmaceutical treatments, but let's look at why medical cannabis might help with these. And to do that, let's take a step back and remember that we all have an endocannabinoid receptor system throughout our bodies. And our bodies are producing naturally occurring endocannabinoids. These are substances, molecular compounds that are very similar to the active compounds we find in the cannabis plant. And they've identified at least two types of these receptors, these endocannabinoid receptors, and they are abundant in what is called the enteral nervous system, E-N-T-E-R-A-L, and that is the part of our nervous system that covers our digestion, how our bodies process, metabolize food, and move waste through our bodies. And they have found that these CD1 receptors are very active in helping to regulate intestinal movement and the secretions that our bodies produce to help waste move through the lower part of our digestive tract. And you see those little green dots all through the sort of GI area of our outline there. And then they looked into the CD2 receptors, and it seems like they are very active with our immune response, and that ties into the inflammation that can be part of these bowel diseases and other inflammatory diseases. What's happening there is that our bodies are seeing a threat, and they're sending white blood cells to try and take care of this threat. And if that threat is an ulcer in your colon, sometimes those white blood cells, although they mean well, are actually increasing the amount of activity and inflammation that's happening there. Does that make sense?
It does.
Okay, good. And we see those CD2 receptors also scattered throughout that part of our system. So we've got a lot going on when we're using whole plant cannabis. So your endocannabinoid system in general is functioning at all times, whether we're adding cannabis externally to our systems, even if we're just operating with the natural cannabinoids that our bodies produce. Your endocannabinoid system is helping your body maintain homeostasis or balance. And when we're talking about GI diseases, there are these sort of 4 dimensions that your endocannabinoid receptors are helping. You can imagine it like trying to tune a radio. We're trying to dial things in so you get a perfect signal without a lot of interference. So it's working on digestive motility, which is how quickly and effectively things move through the digestive tract. The little cilia push everything along. The secretions, as we mentioned, that are sort of helping things go through the process. Visceral pain, which I mean, it's hard to convey in words, I would imagine, but, you know, when you have visceral pain, this is different from sort of a tissue-based pain where you get a cut on your finger, but this is a pain that is in the organ itself. And the endocannabinoid system helps moderate and modulate our response to that and our perception of that pain. And then, of course, inflammation, both in the digestive system and as David's story with his skin condition indicates, you know, that's another inflammatory issue, just, you know, in the organ of your skin rather than the organ of your colon. And THC and CBD are interacting with these receptors in a highly intricate dance to moderate and modulate all of these things. Again, it's just fascinating that those CB2 receptors are in some cases turning down the response from our own white blood cells that are sort of attacking our bodies in these instances. So, you know, I went and I looked, David, as I was preparing for this, and there are not a lot of studies on cannabis for these digestive diseases, and I was surprised by that. There's a lot of anecdotal evidence, which is very powerful. But I don't know when. I would imagine that when you were diagnosed with this, maybe you did some research. Were you able to? Certainly, when you started with medical cannabis, did you find a lot of research, or was it more anecdotal?
There was not a lot of research, and I did ask my gastroenterologist, and his reluctance to get involved in the medical cannabis program is largely because there is not strong clinical evidence, and good science does not rely on anecdotal evidence.
Yep.
And I don't disagree with that.
Right. And so you're saying that in his mind, it's just that the science isn't in, not so much that he works for an organization that would frown upon writing a certification?
I think that is his concern, or was. I think that he may have, in his mind, thought that the medical cannabis is an effective treatment or a possible treatment, but the politics of organized healthcare make him reluctant to step the boundary.
Yeah. And that's a frustration that many medical cannabis patients face with any number of conditions. But I did find a couple of good lab, science, research studies. This one is from June of 2010, and it used, these rats, laboratory rats. Some of them were given the sulfa drugs as a control group, and then the others were provided with both THC and CBD, and they found that, they did well both alone and in combination in healing these ulcers, in reducing the inflammation, and improving the digestive motility in these poor little rats with colitis. So interesting here was that they found the optimal dose was 10 milligrams, the equivalent of 10 milligrams of THC at least, which is a pretty, that's a low dose, that's a starter dose. Have you encountered any information about low dosing, or do you find that there's a threshold when you're using your medicine that beyond which you're not getting any more relief?
I did report to my doctor that the medical dosage seems to be much lower than what we normally consume.
Mm-hmm. In a recreational or adult use sense?
Correct.
Right. So just a little bit.
Goes a long way.
Goes a long way when you're looking for that medical. All right, so those are our rats. And again, this is CBD and THC, both alone and combined. And so that gives us some hope. And then in October of 2013, this journal, the Clinical Gastroenterology and Hepatology Journal, is the official clinical practice journal of the American Gastroenterological Association. And this was a human trial, and they used smoked cannabis. The placebo group, that's a big, that makes scientists happy when there's a placebo-controlled study. And they said that the placebo group was given cannabis cigarettes out of which they had removed the THC molecule. And I want you to keep that in mind because I have a question about that. That I don't really have an answer for, but it's interesting to think about. So we have a small study with 21 human patients. These are folks who, like David, have tried everything without much success. And in the cannabis group, 5 of 11 subjects, which is about 45%, had complete remission. 3 of them were able to get off of their steroids. And this was a short course. 5 of 11 achieving complete remission, 10 of 11 seeing significant benefits compared to the placebo group without the kind of side effects that are debilitating and like maybe the steroids that you were telling us about, David. What was interesting to me was that 4 out of 10 of the placebo group, so there were 11 who got the cannabis, 10 who got the cannabis where the THC had been taken out. 5 of the cannabis group subjects had complete remission. 4 in 10 of the placebo group had clinically significant improvements in the course of their disease. And that made me wonder, did they take everything out or did they just take the THC out? And maybe those placebo folks were getting some of the medicinal benefits of the non-psychoactive cannabinoids. I think that would be an explanation for why many of them saw good relief. David, have you tried any, like our CBD tincture, or do you find that CBD is a particularly helpful compound for you, or not so much?
I tried the CBD and seem to prefer the THC-based.
Really? In terms of symptom relief, or?
No, because the symptoms are gone. At this point, it's maintenance and preventive.
Okay.
So there is the pleasure.
It's nice to feel good.
Pleasure effect.
It's nice to feel good to take a medicine that doesn't,
I don't mean to make people jealous, but I'm a happy man.
And you deserve it. 15 years doing that. All right. So those are 2. We've got some questions coming in. Thank you so much. So we have a question. Please explain what you mean when you say remission. So remission means that the symptoms are gone, to all intents and purposes. And David, maybe you can talk a little bit more about,
With a chronic disease, they're reluctant to say that you're cured. And I was told that I would come and go throughout my life. And so until I'm older, I don't know that it's a permanent cure. But at this point, a year and a half plus, I am well beyond the best record that I'd ever set was maybe 6 months.
With the pharmaceuticals?
Yes.
Wow. So hopefully that's helpful. So remission, we're not talking about curing the chronic disease, but the symptoms are put to bed. They're
gone.
So, and another question, has it reduced the inflammation or just the pain? David, have you?
It has apparently healed the colon. I have not had a colonoscopy since I've been in this state of remission, and but I would presume that the colon looks healed.
Right.
There's actual healing. There's no bleeding.
Right.
Gone.
No bleeding at all.
Gone.
And that's an indicator that the inflammation is also.
My general digestion is improved.
Really?
If I'm going to plan on a pig out, a big spaghetti dinner, I'll take a capsule or two before dinner.
Mm-hmm.
And without any side effects, I generally do not get gastric distress at all.
Really? Better than Beano? Better than Imodium? All right. So thank you for those great questions. I hope those were helpful answers in terms of has it reduced the inflammation or just the pain. I think it's both, it sounds like. And David, I would be interested this is an interesting thing to say, but I would be interested the next time you do have a colonoscopy to see what your GI doctor says. And you know.
Good faith, I will share.
Okay. You can't have fun with this, you know. Look at my pictures. But no, I think you're right. I mean, if there's no more bleeding, then those cells must be gone, and the inflammation must be controlled. So. All righty. We do need to remember when we're talking about lab studies, especially the one with the rats. Now, that human trial definitely used smoked cannabis, but when you look up studies, and I'm going to share a couple of resources with you at the end where you can go and do some research on your own. When we're looking at a lab study, we're typically looking at a single compound study, often a synthesized version. So they will take synthesized THC, lab-produced THC, and take some ulcerative colitis cells and play with them in petri dishes and see what happens, or inject them into a mouse and see what happens. When you're using the whole plant, whether you're smoking it, whether you are eating it, when you're using a product made from all of those beautiful crystals that form on the female flowers of the plant, you're getting dozens of therapeutic compounds, and they're acting in synergy and in ways that we don't even understand fully what each of those individual compounds does yet, let alone how they do this beautiful dance together that can result in these sorts of improvements like David is seeing. So just keep that in mind. Keep that in mind. We don't want to say this is a cure, and we don't want to say that every time there's a study that shows promise that it's automatically going to be transferable. We're using a natural product rather than a pharmaceuticalized one. So we talked about some of the side effects, certainly, of the steroid drugs that are often prescribed for these conditions. I want to be honest and upfront about the side effects from cannabis. And David, you already touched on that top one there, euphoria. If you're using a product with THC, you are going to likely feel some mild euphoria. I'm curious, you mentioned that a therapeutic dose, a medically helpful dose, tends to be lower than what somebody who's out, using as an adult in a social situation might have. Are you still getting that feeling of well-being? Are you still?
Yes.
Yes. You've got a big smile on his face.
Actual mental acuity. I have to say that the heightened state of awareness, contrary to what the image of Cheech and Chong is, I actually feel mentally sharp. Yeah. Well, and maybe because you're not focusing on the fact that you feel bad. I'm the same. I am a big fan of medicines that make you feel good as well. So that is a side effect. There can be motor coordination problems or slowing. It's not, like when you have too much alcohol and you're staggering, but there can be reaction delays and things. Short-term memory loss. A lot of folks question, that's one of their big concerns. If I start using this, am I going to forget everything? And the answer is if you are at a therapeutically appropriate dose, you should not have too much trouble with that. And while, somebody may, under the influence, have short-term memory loss, forgetting where you left your keys, forgetting that your reading glasses are on top of your head, that is not a permanent change. When the effect of the cannabis wears off, your short-term memory is not negatively affected. Red eyes, dry mouth, low blood pressure, heart palpitations, and then these bottom two are pretty much if you've had too much, especially with edibles. Anxiety can shake
into panic or paranoia, and then hallucinations. Those are indications that you've surpassed your therapeutic dose. And there's not much, once it's in you, there's not much you can do but wait those experiences out, get yourself in a comfortable place, eat something healthy, put on some music that you like, deep calming breaths. Good to remember that cannabis has no known lethal dose. LD50 is a scientific term for a dose of a substance that will kill half of the test animals that you give it to. And there just isn't one for cannabis. And we don't see negative drug interactions. And actually, David, maybe you can chime in on that. When you started with medical cannabis, were you still using pharmaceuticals?
I was.
You were. And did you find any negatives?
There was no interactive effect that I could identify.
Okay. But you just knew that you didn't need, you could stop taking this one, or?
Well, I phased out the mesalamine medication.
Okay.
And over just a couple of weeks, and I thought, well, if the colitis returns, I'll just go back to it.
Right.
And I still have the bottle of pills.
A year and a half later. Very nice. We have to say it. Always remember to start low and go slow, especially if this is new to you. You can always add more, but again, once it's in you, you can't get it back out, and there's nothing to do but wait if you've had too much. So, and I see another question: is CO2 oil just a liquid form of cannabis? And do you believe that CO2 oil is as beneficial or maybe better? That is a great question. Two of them, actually. And I am going to, wow, it's actually a great question and a wonderful segue into our next slide, actually. So let's look at methods of ingestion, and we'll make sure that we talk about CO2 oil while we're here. I'm making a note to myself. If you're just joining us, we are talking about cannabis, medical cannabis, and inflammatory bowel diseases with our special guest, David, who is a WCN member and a longtime ulcerative colitis patient who has been in remission now for over a year and a half, using medical cannabis, having weaned himself off of the pharmaceutical drugs that he was using with varied success. So again, David, thank you for being here. And of course, we've got producer Ben, who's keeping us rocking and rolling and plugged in with all of our tech. Yes, thank you, Ben. All right. So let's talk methods of administration. What's your preferred method?
Digestion.
Get it in eating?
Yes.
And edible. Okay. So
And capsules.
And capsules.
Capsules the best.
Really? And how did it take you a while to find what worked best? Did you?
It did. I have experimented with smoking and vaporizer and cookies and tea.
Wow.
And capsules.
Okay. And so far, capsules are really
easy for a busy working person.
Easy and yes, absolutely. And
no calories.
No calories, right? Precise dosing, so you know you're getting your 10 milligrams, and that I'm sure is a help. So let's look at inhalation first. So when you are inhaling, and I have not yet forgotten, or I haven't forgotten about the CO2 oil. We're about to get there. When you're inhaling, whether you're smoking or vaporizing an oil, an extracted oil, the active compounds are getting right into your bloodstream through your lungs. So it's very rapid onset. So 30 seconds to a minute after a good inhalation, you should start feeling relief. And David sort of alluded to that when you mentioned your first experience, where you had that cramp and it was almost instantaneous.
Gone.
But it was just gone. So while vaping may not have it worked out in the long run as your go-to method, in that case, inhalation was effective for an acute situation.
Absolutely.
So, and I would assume that maybe now, well, hopefully this doesn't happen, but if you had, if you had a cramping episode, that might be a quick go-to.
Quick go-to.
Yeah. The concentrated oil, so a CO2 oil extraction is a process. So if you look at that pretty bud picture that's there on the left, you see those tiny little white crystals or resin glands that are covering that female flower. Those crystals are where the active compounds in the plant live. So the THC is in there, the CBD, all of these other beneficial compounds and even terpenes that create the smell of the different strains. They live in those resin glands. To make a concentrated oil, like a CO2 oil, you need to strip those resin glands off the leaf and then, as it says, concentrate them. And there are a number of different solvents that people can use to do that. So a very simple way to do that is to take high alcohol, like high potency alcohol, and soak the bud in that. You can use glycerin or hemp seed oil and just put the flower in it and do a cold process, come back in 3 months, and those resin glands will have melted sort of into the glycerin or the alcohol. And that's how we get a tincture. You can also use other solvents. Some people use butane. We choose not to. We choose to use a CO2 method, which is a little bit safer, and the residual, there are fewer residuals in the finished product. And so CO2 does a very effective job of stripping off those active compounds, and then you can sort of compress that into a concentrated oil. Sometimes they take a liquid form, and that's what you'll see in our vaporizer pen cartridges. Sometimes you can make what's called shatter, which is kind of it almost looks like glass, and it's got a consistency that's more brittle. And you can heat those and inhale them, and you're not getting the burnt leaf and stem that you are when you're grinding and smoking a joint. So when you're using a CO2 oil, you are getting a much more concentrated dose of the active ingredients, so you can typically use less. You may not need to take more than a sip or two from your vaporizer pen versus, smoking an entire joint or half of a joint to get relief. And so that's some of the benefits of those types of products. So, and you said have you tried our vaporizer cartridges, or did you?
I have not.
Okay, you use the whole flower.
Yes.
Vaporizer, gotcha. So with ventilation, your titration is easy and it's rapid onset. So if you're having an acute, onset of symptoms, you can cut it off at the task there. As David mentioned, he prefers to ingest, prefers our edibles. Now, you do have a longer time to onset because you've got to go through the digestive tract, and the liver comes into play, and so you might eat a cookie or take a capsule and not feel anything for the first hour or so. And this is very dependent on your individual metabolism and what else you ate that day. But the variety here is huge. There are just a whole lot of options. You rattled off a bunch of them. I have a question for you, David. Now, we're talking about digestive tract disorders. Are there edible preparations that you found upset your stomach or upset your condition?
I have not, other than the tinctures I tried, and they did seem to upset my stomach a bit.
Okay.
Not sure.
Okay.
But other than that, no, the capsules, they all seem to improve.
Great.
My digestion.
Great. And I'm curious, have you tried, because I do know that we did, when we first started making our tinctures, we made them with a glycerin base, and I remember hearing from a couple of patients who had Crohn's or other digestive diseases that they thought that maybe it was the soy and the glycerin or the glycerin itself that was causing the issue. And I'm just, I don't know if...
And this was recent,
so it would have been hemp seed oil. Okay.
Yes.
Okay, all right. but the capsules are working. We've also got the teas and all of the new. Have you tried the new chocolate bars?
I have not. It's only because it's summer. Hard to get home with it.
Oh yeah, very true.
I'll wait till autumn.
Okay. Well, they are also easy to titrate because we made them in those little 10 milligrams. Snap off a block and you're good. So, and then finally, topicals. In your case, you didn't even need to go there, but these are infusions of the active compounds in the plant that you can just put on your skin, and they can be helpful for, as you see there, neuropathic pain, psoriasis, eczema, other skin conditions. You'll feel the effects in terms of pain relief and anti-inflammatory properties very quickly, but because it's not penetrating through to the bloodstream, we have a coconut oil-based topical salve. It doesn't get to the bloodstream, so there's no psychoactivity. So if you're dealing with skin inflammations in addition to your inflammatory bowel disorder or disease, you may find, as David did, that inhaling or ingesting somehow works some magic on that, and if not, you might want to give thought to adding topicals to your treatment plan. So, all right. So how do we go about, what's the process? You're listening, you're thinking, all right, David's story has convinced me that this is something I want to try. What do I do? And the first step is the hardest. We would suggest that you talk openly with your primary or specialist doctor. Did you do this, David, before you started using?
I did. I went to my doctor and my primary care doctor, who was favorable to the process. Wasn't aware of how to do it.
Okay.
Knew that he could, but he didn't know. So I went to my gastroenterologist, and he was philosophically, medically opposed. and then went to the internet to find out where this could all happen, and I ended up in Damariscotta.
Yeah. And I think that's the case for a lot of patients, and it is a frustration. You're already dealing with a serious illness, and you talk to your primary, you talk to your specialist, and they say no, and that's immensely frustrating. But I'll tell you, the more they hear it, you might not be the first person that day or that week to bring this up, to say, look, I tried some that I got, however, and it worked, and I want to become a patient. So, little drops of water on those rocks. So your primary and your specialist, for different reasons, couldn't do it. It's important to know that any MD, doctor of osteopathy, or nurse practitioner can certify. As you see there, some of them choose not to, and so then you end up looking for a cannabis specialist doctor, and you can find them. I probably don't remember your Google search, but Maine Medical Marijuana Doctor.
I think that was it.
That might have been it. That will bring up, the top responses on that Google search are reputable in our state. So, be prepared to educate not the cannabis specialist doctor, but your primary or your specialists. If you're hoping that they can help you, you might want to go in armed with a couple of those research studies. I have some more resources for you at the end of this presentation, so that you're not just asking and getting a no, you're asking and maybe getting a no, but leaving them with something to read. Once you have that certification, whether it's your primary or a cannabis specialist doctor, they will issue you 2 cards. One stays on your person as a patient, and that identifies you if you happen to get pulled over driving home from your dispensary. The other is given to your provider. Now, you've got 3 options in Maine. We do protect growing at home. Patients are allowed to have up to 6 flowering female plants. If that's not an option for you, maybe you live in an apartment, maybe you don't have a green thumb, you can designate a dispensary, which is, there are 8 of us around the state. These are brick and mortar retail facilities that have a variety of products. You see the picture at the bottom there is the interior of our Portland dispensary. And then your third option, if that doesn't work for you, maybe you live too far from a dispensary, maybe you don't have transportation to get to one, then you can designate an individual to grow your plants for you, and we call those a caregiver, a cannabis caregiver. Patients are allowed to have up to 2.5 ounces of medicine product every 15 days. And the dispensaries are inventory controlled and tracked and everything, so they can keep track of that for you. It's good to know that when you're using edibles, the ingestible forms, a lot of times those can be helpful to your budget. Your medicine budget goes a little bit farther because, of course, insurance does not cover this particular item yet. So whichever you choose, growing at home, designating a dispensary, or designating a caregiver, there's just some tips on the right there, what to look for in a quality provider, whether that's a dispensary or a caregiver. You want options. You want somebody who can explain the options to you, because David, when you came in, would you call yourself a cannabis aficionado? Were you smart about cannabis? Were you naive?
I would categorize myself as middle ground knowledge, having not smoked marijuana since I was college age.
Yeah.
And kind of drifted away with it while raising family, and you don't give much thought to it.
Right.
Was in my house for those years with the kids, and never interested me.
Really? Did it's kind of off topic to this slide, but have you been open with your family about this, or have you
totally open.
You have been,
and totally open, yes.
Great. And they were supportive?
Oh, yes.
Well, I would imagine they see the difference, right? I mean, Dad's happier and...
Yeah. Very, very supportive.
Good. That's awesome. Back to our slide. Quality providers should be lab testing their products, and actually starting in this coming year, if a provider is giving you a product that has potency claims on the label, very soon those are all going to have to be tested by an independent third-party lab. So that's just another step in protecting the patient's right to know and be secure that they're using clean and accurately labeled products. They should be giving you receipts. They should be charging sales tax. It's not fun, and we don't like to do it, but they should be. They should use no pesticides. In Maine, here we have pretty strict limitations on that. We ended up using beneficial insects, like little parasitic wasps, and no foliar sprays or whatnot at all. So, and a quality provider should always make you feel safe, obviously. So just a few, as we're coming to the end of our presentation here, just a few more studies that I dug up, and I know that the two that I included in the presentation were older. They were from 2010 and 2013, I think. So I did find a couple of updates. That bottom one is the most recent that I came across. It is in German, but if you Google that title, you'll be able to find a translated version where you can at least read the abstract. So there are folks working on this. There is science out there. And when I say, be ready to educate your primary care physician or even your specialist, these might be some good studies to look at and to print off and share with them. So. And then finally, more information. So on the left there, PubMed is the Federal National Library of Medicine, and it's a clearinghouse. It's a clearinghouse of all kinds of scientific research. It has a very easy search engine. You go on there and you type in marijuana and ulcerative colitis, and it will pull up, what studies it has. Some of those you need to pay for in order to read the whole study, but for all of them, you can at least read the abstract, which is the summary of the study and its primary findings. So if you have an hour or two to spare falling down a research rabbit hole someday, PubMed is a great site to go play around on. The Group Americans for Safe Access, they are the only national medical cannabis patient advocacy group that is really doing work to support patients. And they put out this fantastic series of condition-specific booklets, and one of them is on gastrointestinal disorders. Even more fantastic is that you can download it for free from their website. I believe they're also available on Kindle if you have switched over to ebooks. You can download it for, I want to say, $1.99 per booklet. So that's a fantastic read. Another great resource to share with your primary or specialist doctor. And of course, the Crohn's and Colitis Foundation of America, they do have a main support group. They have recently taken initially they started off being very skeptical about medical cannabis, and they had a sort of a negative tone to their statement about it. In I think 2012, they issued a new statement that basically says what we all say: we need more research, right? In the absence of research, I have to say I really appreciate, David, that you came in and shared your story. I think, like I said, anecdotes get a bad name in contemporary medicine, but it's been very powerful to hear how your life has changed with this.
And 100 anecdotes become science.
100 anecdotes. Somebody just needs to gather them up. Absolutely, absolutely. Good luck the next time you do go in and get a scope. I think maybe for your specialist, seeing hopefully will be believing, right?
Yes.
I hope. All right.
Thank you.
Thank you very much. Thanks to all of our listeners. Thank you for your fantastic questions today. We do have a couple of minutes left, so if anybody has been sitting on a question, if we haven't answered something that you're thinking about, now is the time. And in the meantime, Producer Ben is getting ready to help us sign off. Oh, what a sweet comment. Excellent presentation, very informative, and I appreciate the shared experiences. Well, we definitely appreciate you spending an hour with us on this beautiful day. If you have questions, if something comes up, the minute we sign off, you can always send them to info@mainwellness.org, info@mainwellness.org, and I've got all of our contact stuff here. We are closing in on the 1 o'clock hour. So this is your host, Becky D, with our special guest, David, and always producer, Ben G. Thanking you for joining us. Please have a wonderful afternoon, and be well.